The HIV and AIDS epidemic started around 1981 when the virus was considered a death sentence. With advancements in modern medicine, the virus is now considered a treatable and manageable chronic disease. Around 50,000 people are diagnosed annually with HIV in the U.S. With the 30th year's AIDS Walk in San Francisco coming up, I'm here at a Bay Area Health Center, Santa Clara County's Public Health Department's Crane Center, that has been supporting the fight against HIV and AIDS since 2001 by providing free HIV prevention, testing, and counseling services. In addition, testing for sexually transmitted diseases, STDs, and sexually transmitted infections, STIs, which increase the risk of developing HIV. Here we have the HIV testing lab where two methods of testing are given: the oral swab test and the rapid finger prick test. Results are given in 20 minutes confidentially to patients. Well, Monzon, he's an HIV survivor, and he is a Santa Clara County Health Department HIV and STD Preventions Control social worker. So, Manuel, we're glad to be here at the Crane Center. We're glad to be able to capture the HIV and AIDS epidemic from, the start of the epidemic to the evolution that has taken place within, the years, over the years, and in the 21st century. Currently, ART, antiretroviral therapy, and ARVs, the drugs used to treat HIV, are so advanced. There's so many different drug cocktail options that patients can take to remain healthy and live long life expectancies of, a HIV negative person. So despite the advancements of medicine, there's still an unhealthy stigma that surrounds the virus, and is discouraging people from, getting tested and knowing their status out of fear of potentially having this dreadful disease that in the modern era is very manageable, very treatable, and, definitely can be prevented. So how important do you think it is for people to realize that having unprotected sex is a risk, that any risk is a risk at all, and the importance of being aware of their risk, their sexual partner's risk, so that they can prevent themselves from contracting the HIV virus?
We highly recommend it for people to use protection always when they had sex with somebody. Most because sometimes the people, they don't tell the truth when they're asking about the HIV status. Some people, they lie about the HIV status, and also it's a lot of misunderstanding about to be undetectable. Because you mentioned about the HIV medication is really effective and with less side effects, but the misunderstanding is because when the people say undetectable, they are thinking they are negative. They are not. They continue having the infection. The only thing, because the virus is very extremely low, below 40 copies, but the people is still infected with HIV.
Right.
And also another issue, it depends on the immune system of the person. They can be right, and sometimes the person, they had confused about undetectable, then they're thinking they are negative. They are not negative.
Right.
It's very important they need to understand the community that is not negative. It's undetectable, and the people, they still with the HIV infection.
Right. So, how do you suggest we handle the stigma of the HIV and AIDS in society in order to minimize the fear of the virus that, as you mentioned, is now undetectable with the modern medicine, but they still carry the virus? So how do we minimize that fear of this stigma to encourage people to start the discussion and get tested?
Yeah, I think the most important I can see for all these years working in HIV, it's educating the community. And the education for all this year, what I can see, and I highly recommend it, is to start with the parents. It's very, very important the parents to be educated, to educate the kids. The future community is going to be sexually active, honestly, because youth communities start having sex earlier at this time. but parents has a huge responsibility to break the stigma in our community, to be educated and also to educate their kids too.
Right. So, you talk about parents educating their kids, and with 13 to 24-year-olds accounting for 1 in 5 new HIV infections a year, do you think the earlier sexual education takes place, the better, so that youth know their risk of contracting STDs and STIs and know the consequences so that they can protect themselves against these potentially life-threatening diseases?
I completely agree, to the school plays a huge role here, because I hope in the future, all the schools start providing sexual education earlier, because it's the only way we can minimize the HIV infection in our community, plus educating the parents when is the best time to educate the kids, because the parents know when is the proper time to educate the kids.
Right.
When it's going to be, because they know better than nobody their kids.
So yeah, definitely, it's agreeable that HIV, education should take place early on, and as soon as youth are sexually active, that should take place. So, in middle school and high school, college curriculums, like you say, it's up to the parents to, know their kids. Are their kids sexually active? Should they engage in these conversations with their kids? But what role do you think the school system has in educating students in middle school, high school, and in college with the curriculum to, make them aware of their sexual health, that it's an important part of their overall health?
Yeah, here in Santa Clara County, a lot of schools, they are start doing education in HIV and other sexual transmitted disease, because we have a component here in Santa Clara County in our program is and they go to the schools and provide all the educationals, also providing different workshops to the students too, and also, for example, I work directly sometimes with Santa Clara University, to provide more education to the community. We conducted like a photo project almost a year and a half ago, working with the students, why it's important to educate them and also to break the stigma in our community.
Yes. Very important to, break that stigma. And because HIV, had an initial stigma when it first, came out in 1981, around that time of being a death sentence, it's hard, for people to know that in this day and age that, people with HIV can live a very long, normal life with taking, these different drug cocktails without knowing the power of ARVs and how HIV can suppress the virus in a person's body and make them undetectable and ever prevent the transition from AIDS. People are still very fearful of the virus, and it contributes to this stigma. So as a counselor and as a social worker who works with people on a daily basis, how do you educate your patients about HIV and the medications that can be potentially life-saving treatment?
Yes, when the person tested HIV positive, and we are very lucky here in Santa Clara County because we had the program called Positive Connection Programs. We developed this program in 2009 to help people to linkages to care as soon as possible after they tested positive. Why is so important? Because when the person tested positive, we do the counseling with them, talking about how the HIV infection impact the immune system, how they can live a longer and positive life, changing diet, physical exercise, and also the most important is to take their medications every day, and also practicing safer sex. It's so important. And the difference between HIV and AIDS, and we have many different kind of topics, depends on the patients.
Right. So you mentioned the importance of taking the treatment every day. Now, two of the things that people are hesitant when, newly infected to start HIV treatment is, the side effects of the treatment and, the cost of the treatment. Now, this is life-saving treatment that people need in order to stay healthy and survive and prevent that transition from AIDS. So how would you recommend that patients that are newly infected with HIV cope with the side effects of the ARVs in order to maintain a consistent treatment regimen and avoid an immune response of drug resistance?
Yes. How I help them, because it's important they understand the new generation of HIV drugs is less side effect than before. Before we have very horrible effects in the beginning of the epidemic, but at this time it's very minimal because a lot of the patients, they don't have any side effect at all. A few new patients I have, maybe a couple or 3 or 4, they have a side effect like very upset stomach, a little headache sometimes, or sweating a little bit, like a fever, and a little bit diarrhea, but it's not very common at this time with a new generation of HIV drugs.
Right. And, like we, discussed, in the modern era, the HIV and AIDS epidemic has evolved significantly from, the death sentence placed on the virus in the 1980s to now being able to be HIV positive and live a normal, productive, healthy life. And thanks to, the medicine, the ARVs, but there's talk of a cure of HIV, in the near future. Do you have any insight on that?
I think now people living longer. I can be one of the examples because living with HIV for 23 years and living a very positive life and very productive life because I continue working, I continue supporting the community, and I can do the best for them to keep going in their lives too, because when I having the new HIV patient and they know about HIV positive and it's a new infection, sometimes I can see that patient go to the dark life, but I recognize immediately and I bring back to the clients to that light, supporting about, in general in life, how they can change it and live very positive, because HIV is not the end. It's another step in their life, very positive life. And sometimes talking with patient, and say, well, we are positive, and say, yes, we are positive, but we need to think positive now. We cannot be thinking negative, because negativity is not going to take any way.
Right.
Thinking positive and living positive life, you're going to have a very successful life. HIV is never going to stop you, whatever you have to do in your life in the future.
Yes, very powerful. And, with that said, do you believe, the advancements in medicine and, a possible cure in the future, whether, if it is found or if it's not, do you believe that this will reduce the stigma of HIV and AIDS in our society?
I completely agree with that, I can say before in the 80s, 90s, I can see, because I tested positive in 1993, I cannot feel any hope for a cure. But now you're asking the question, yes, I had a hope for the near future, to be a cure, and I hope it's coming soon.
Yes.
I hope so.
Definitely. Now, you say, you've been positive for 23 years, and you're impacting so many people's lives in such a positive way, like you said, turning that positive diagnosis into something positive. Now, what is a day like in the life of Manuel Monzon, an HIV positive man who's using his status not as something to hide, but something to educate his community about?
I'm very happy person. The most important for me is get up early morning and say thanks to the power of the universe for this beautiful day, because it's not only way I can think about life, receiving positivity in the beginning, and I keep going in my good day. I'm very happy. I'm very proud and I'm very honored to work with all new HIV positives because I can support them to live a healthy life. And also when talking with them, they ask me the question and say, how is your life going in one day? You know, I told them the only way I can see my life is very positive and living very productive life because HIV is not stopping me for anything in my life. Because when I started in 1993, I had the same feelings they have, you know, they're thinking life is gone, they're going to die. I got through all the feelings, but I recognize I'm not going to die and I'm still alive for close to more than 23 years. Yes. You know, I'm so happy to be here. I'm so happy to continue supporting the community.
Yes, that is so powerful and inspiring. And myself and Impact with Jeri Perkins, we want to honor you with the Impact Honoree Lifetime Achievement Award because the work you're doing here in Santa Clara County is reached so far beyond this community. It's impacting, you know, millions of people around the world. And it is so special, and I just want to thank you for your work and for starting this discussion every day and choosing courage and not fear when dealing with, you know, your HIV diagnosis because you are giving hope to so many people. So I just want to thank you for this interview and thank you for just doing what you do every day.
Thank you so much for coming, and I'm so happy to be here. I'm so happy to send a message to the community, you know. Be safe, be educated, and educate parents. Please educate your kids because it's the future of our community. And have a wonderful day.
Thank you so much.
Thank you so much. Thank you for coming.
Thank you. That was so wonderful.
Oh, you're welcome.
Appreciate it.
You are welcome. You are welcome.
As soon as you enter the Crane Center, you see the emphasis they place on prevention. The front wall is filled with contraceptives. And also the Get Yourself Tested campaign button, GYT. The Santa Clara County Public Health Department recognizes HIV as a public issue that needs to be taken care of as a community of people rallying together, ensuring that they're getting themselves tested, knowing their status to protect themselves as well as their sexual partner from contracting HIV or other STDs and STIs. And on the side wall, we have pamphlets that provide sexual education on the various STDs and STIs. So clearly there's a lot of accessibility for sexually active people in terms of prevention and protection. So there's really no excuse. You have to be aware and you have to start the discussion. Choose courage, not fear, when dealing with HIV in order to protect your community, yourself, your sexual partners. Get yourself tested today.